Welcome to Pharma Pro Mastery Hub. Today on Know Your Medication, we'll be looking at the drug furosemide. Furosemide is a powerful diuretic, also called the water pill. Furosemide is a loop diuretic used to treat water retention, that's edema, especially in conditions like heart failure, liver disease, kidney disease, or high blood pressure. So what's the mechanism of action of furosemide? Furosemide acts on the loop of Henle in the kidneys, specifically inhibiting the sodium, potassium, and chloride co-transporters. This inhibition leads to increased excretion of sodium, increased excretion of chloride, increased excretion of potassium, and increased urine production. When all this happens, this diuretic effect helps to what? Reduce the fluid overload, reduce edema, and lower blood pressure. Furosemide comes in tablets, oral solutions, and injections. Furosemide is usually taken once or twice daily, preferably in the morning or early afternoon, to avoid waking up at night to urinate, which might cause discomfort to the patient's sleep. So for adults, the dosage is usually 600 milligram per day, though it is rarely needed. So the initial dose is often 20 to 40 milligram once daily, so it is increased by the pharmacist or the doctor as needed. For children, the dosing is based on weight, which is 1 to 2 milligram per kg per day, not exceeding 6 milligram per kg per day. High dose must be used carefully because it could lead to severe fluid retention and electrolyte imbalance. Side effects of frusemide includes frequent urination, dizziness or lightheadedness, cramps or irregular heartbeats, which could be due to low electrolytes such as potassium ions. Then that side effect could be dehydration or in severe cases allergic reactions. Important notes to healthcare professionals: monitor the electrolyte regularly, especially potassium levels and kidney function. You assess the patient hydration status before and during the treatment, especially in elderly patients. Consider those adjustments for patients with renal impairments, and then be mindful of drug interaction, particularly with ACE inhibitors and NSAID, which may exacerbate side effects. So here are some advice for the patient. You advise the patient to check their weight daily and ask them to report any sudden weight change. Advise patient to avoid standing up quickly to avoid dizziness. You also advise the patient to get regular blood tests to check electrolytes and kidney function. So if you found this information helpful, don't forget to like, share, and subscribe for more. Remember, medication mastery starts with knowledge.